We wish to use this template to support any country because we will then have the experience, the knowledge and the momentum.
Distress and desperation as the people of India are smothered by a second surge of the pandemic.
They are dying on the way to the hospital because they are going from hospital to hospital trying to find a bed.
In a country of 1.4 billion, the authorities thought they'd escaped the worst last year. But they were wrong. The World Health Organization has classified the variant first found in India last year as a variant of global concern, as early studies show it spreads more easily. Everywhere there's a shortage of beds, oxygen, medicine and health workers, and people, even if they're not critical, are flooding hospitals. Dr Bharat Pankhana has been talking to colleagues in India. He's a UK expert in communicable disease control, and he's been told many people are turning to the black market.
So there are astronomical costs for oxygen cylinders, astronomical costs for a GP consultation, and huge unaffordable costs for private ambulances. All this is indicative of a system in meltdown.
Funeral pyres burn through the day and night. The SARS-CoV-2 variant B.1.1.7, originally identified in the UK, has become common, and a new variant B.1.617, incorrectly nicknamed the double mutant, is dominant in some areas. It has several mutations on its spike protein, which have been associated with increasing the virus's ability to bind to and enter human cells, and improving the virus's capacity for evading the immune system.
I personally feel there is no evidence to concretely say to us that it is all the fault of this variant. At the moment, the indicators are not clear-cut that it is highly infectious, highly disease-causing. What is quite clear is a lot of people have been exposed and therefore a lot of people have got infected. Even if it is a more dominant strain, the point is they all got infected. And they got infected because of a failure of infection prevention measures.
Are you surprised that India is even in this situation?
I'm disappointed. I'm disappointed because this is clearly showing that whilst India did very well in the beginning, they then felt erroneously. I really don't know how they managed to make what we would call simple error, which is that self-belief that it's all come and it's all gone. Look at us, how wonderful our immune system is. They dropped their guard and they started human-to-human interactions. So they had political rallies, their cricket matches, weddings, crowded transport systems.
India has been slow to start vaccinating its people, but for the past 6 months it has been a leading voice in a group of around 60 countries trying to lift patent protections on COVID-19 vaccines. US President Joe Biden backed negotiations for the waiver of intellectual property rights as a means for poorer countries to make their own. But the EU doubts this will work, and instead leaders want the US to end its export ban on vaccines and vaccine ingredients that they say prevent production.
So I have advocated for a long time that if you leave it in the hands of the pharmaceutical companies to supply the vaccines, then we are beholden to their supply chain. I'm really pleased to see that the United States has issued a waiver for the patents on these vaccines. And what that means is in time, countries like India, Singapore, Brazil will be able to set up plants to manufacture more vaccines and immunize their people and people regionally.
And I understand you and some of your UK colleagues are reaching out to help. What are some of the things you're doing?
This is a multifaceted approach at helping out India, and I hope that now that we have set out to help India, we will help any country should they also have a surge. So it is a multi-dimensional approach, such as remote clinical clinics. In other words, we will help the clinicians in India, and we will also help patients in India with respect to triaging them, whether they need hospitalization or not. So that's one. The second one is raising money. Third one is raising awareness. And fourth one is giving good public health advice, like set up field hospitals, set up operations, and we are procuring funds and items to send to India, such as oxygen concentrators. Oxygen concentrators are in much short supply, and there's a dire need for them, especially when they start setting up many field hospitals.
Oxygen concentrators can be used by people who do not have enough oxygen in their blood. Unlike oxygen in cylinders, concentrators can be used at home and plugged in to an electricity source. They take in normal air, which is 79% nitrogen and 21% oxygen, and separates them using a sieve material, absorbing, then releasing the nitrogen and providing continuous oxygen to the patient. Around half of the states in India have imposed a total shutdown, and there's increased pressure on the government for a national lockdown. Little can be done about the infections that have already happened, but what can be done to stop further infection?
A strict, a thorough, extensive lockdown will at least stabilize the rise in number of cases. And the very big important advice is infection control, because preventing new cases equals multiple things: infection control, avoiding crowds, and one more thing, immunization.
As countries close their borders to India, it's a stark reminder that none of us are safe until all are safe, which is why the doctor and 200 UK-based colleagues want to use their experience to hopefully avoid another deadly pandemic outbreak.
We wish to use this template to support any country, because we will then have the experience, the knowledge, and the momentum. And what we need to do is be able to support other countries, because what has happened in India will happen in Pakistan, will happen in Bangladesh, Argentina, Brazil, etc. So I feel this is, whilst we are Indians helping India, it mustn't be seen as Indians helping India, but it is a case of, now that we've helped India, we will continue to help other countries as well.
Thanks for watching. Don't forget to like, comment and subscribe, and hit the bell button below for notifications. We'll see you next time.